And then it's determined that, oh, actually you need to get something else first. So you take the gloves off. You've never even touched the patient. You just throw them away immediately. You have to go and get something else. You come back, you put on a new set of gloves. You go in and out gloves, more and more and more. At the hospice, their motto was, there's no emergency in hospice, which is part of the philosophy. It's part of more of like this calm approach to the patient. What does the patient need? What can I do for this patient? You go in, you assess the situation, you determine what you need, then you put on your gloves if you need them. A lot of times they don't need them, and so they just didn't use gloves, only when medically appropriate. How to kind of figure out the difference between conventional and palliative care. That's when we look at the ethnographic data. I love qualitative data for so many reasons. You can quantify qualitative data sometimes. It's great. So looking at, I chose intravenous bags, the PDC bags, as a particular, I thought it was particularly helpful to look at this information because it suggests a whole number of other materials that are going in. When you have an IV bag, you also have the tubing. You have to change it every 3 days based upon infection control standards and that sort of thing. So in conventional, you're using about 2.5 IV bags per patient per day. For palliative care, it's a little under 1 bag. And then in hospice, it is 0.07 on average per patient per day. They aren't using as many of the dripping drugs in hospice. So there's a huge difference in the materials that are going in. And I have a great quote I did not include here. I should probably put it in here. Or maybe it is here. Oh, it is here. Here's the quote. Conventional care means more of everything. So the more of everything